At the May 2015 World Health Assembly, country leaders and health experts came together to discuss ways to close the immunization gap so no child misses out on the life-saving benefits of vaccines. We asked these leaders, what must be done to close the immunization gap and make sure every child has access to vaccines?
There's the need for innovations, there's the need for ways to reach all children with vaccines, ensuring that vaccines get to countries and that there's access to them, and then that countries have a sustainable program to continue to deliver them.
What we need to do first is to pay attention that we still have groups of people not being adequately immunized, so we have disparities within countries, across countries.
What it takes to reach the last 20% is actually quite different than what it takes to reach the first 80%. You know, we did that pretty, not easily, it was a lot of hard work, but with some fairly standard operating procedures. Whereas now, the last 20%, you know, a lot of those kids are in conflict zones, post-conflict areas, you know, reservoirs of vaccine-preventable disease. They live in very poor, very large, tough terrain, you know, weak supply chain. So we've got to change from a mindset of standard operating procedure to one of problem solving. And that actually requires innovation.
In Thailand, the WHA program has been evolved for decades. Now we no more morbidity and mortality for vaccine preventable disease in our country. But however, some challenges remain, such as to tackle out-of-pocket population who is vulnerable to access to immunization.
Whenever a sick child or even a well child is brought to a health facility, whether it's for diarrhea, for pneumonia, for fever, for whatever, the health worker should have that cognizance that this opportunity should not be missed for vaccination.
The last mile of this supply chain is the most precarious because a lot of times it involves a nurse from a local clinic going to the storehouse where the vaccines are stored, picking up those vaccines and getting them back to the community health center in time to immunize the children. And those nurses, they could be on foot, they could be relying on a bus, the bus could break down, it's bad roads, there's been a flood, there's a conflict.
I think that we need to move past national statistics and even past districts and look at communities and interact with communities about what are those barriers. Are they gender barriers? Are they financial barriers? Are they supply barriers? But we need to dialogue with communities and understand what are the true barriers for them to get immunization.